Are you all ready for today?
I'm ready. Let's do this.
We do it.
Except for I lost my vets.
What?
I lost my vets.
Oh yeah, they're taking the tour. Come on, baby. All right.
They're probably like wondering, where do we go? When
Sorry.
do we talk?
It's so nice to get to see doctors.
He says I don't want to go in there.
Okay.
Am I going to sit in one of these?
Yes, and so is Dr. Pettigrew.
Where?
In one of the nice, fancy, schmushy chairs. I will sit off here to the
Can you
side
sit there or not?
Yeah.
so you guys can see.
I got Kitty sharing mine. Do you need a chair with a back?
No, I'm fine.
They're pretty comfy with that little pad. All right, guys. Thank you so much. Let's see here.
How do you do this all the time?
You know, Jackie would make me come up here and she's like, just talk about nonsense. It gets you more comfortable. So here they are. They're all talking to you. The people in the blue are our moderators.
Okay.
I have questions I will ask you guys because it could get crazy.
Yeah, I'm not going to look at that. I'll look at you.
It's distracting.
Yeah.
So, guys, this is our wonderful Dr. Darcy. She is so amazing. And this is Dr. Pettigrew. Dr. Pettigrew
Some of them I remember.
started with the rescue.
Working.
Or, I mean, not started with the rescue.
And he'll have to tell you how that came about.
Started
That was
the-
before me.
Yes, was the first vet for our rescue, if I say that right.
Yes, it would be, I don't know, I can't remember what year, but it was before there was much of a rescue. It was, from Jackie's perspective, how do I do what I want to do? And then I helped her with the plan, basically.
Really?
Yeah.
And so now, is it uncommon? That's actually one of my questions. Is it tricky to have a vet backing a rescue? Because that's really tricky for you guys, I would think.
Well, for me, for helping start one, you have to believe in what they want to do. You have to be of the same mindset, and you have to have the desire to see something work and see it through. And then you have to have someone like Darcy that comes along and picks up that baton and carries it further. And there's always going to be a need. It's finding somebody who has that same interest and desire to help, same passion.
Is it unusual for rescues to have a vet backing them? Is that uncommon, or is it pretty common?
I don't
Do you know?
I don't think a lot of them, they just take them to local vets, I feel like. Didn't Jackie use just local vets?
But I think the mindset of many veterinarians, unfortunately, is these are kooks. They're just collectors.
Yeah.
And I'll help them, but I'm not going to be part of their passion, part of their dream. And so I think it's difficult for the veterinarian to embrace what you are doing as something that's not goofy. You know, it's who wants to have 50 cats hanging around and then hope that you have 20 people come and help you.
Right.
So I don't know why, but I think the veterinarian has enough on his plate, and many of them would volunteer if they were asked. But I don't think that the shelters, rescues, feel like they can trust a lot of veterinarians either to really help them with their dream of saving and rescuing hundreds of cats.
Well, and I think the interesting thing is there's a lot of trust that has to go into a veterinarian to be able to allow a rescue to work under you, if that's the correct phrase, or work.
Yeah, I mean, you have to, I mean, legally, I can't even have the drugs here that you need, some of them, without knowing that I trust you totally.
Right. And so that's
I mean, because I have to have 2 DEA numbers, or two
you have
DEA
to have
numbers.
a lot of licenses in order for this to be able to work. It costs a little bit extra too. It's a big cost.
So I don't think some rescues do nearly this extent.
as far as like care, like medical care.
Right.
Yeah, we try to hide ourselves.
I think the unusual thing
I think that
is
started too with Jackie and you constantly being there when she had questions.
Right.
And then when I came in,
constantly. You're right.
you know, I mean, there's not going to be always a veterinarian that wants to have questions off hours.
And that's, yeah.
And so that becomes a problem, but I just came in and I was in that era where I'm like, wow, I mean, I can't tell you how much I've learned.
Yeah.
Because of the volume of questions. Like, and stuff that, like he said on the way here, you're willing to try.
We will not.
That
Yeah.
And we learned from
we aren't
you.
going to learn because we aren't going to have
Because-
people do that maybe.
Yeah, a lot of people aren't going to take that FIP cat and invest the income without having a guarantee. And we will learn from shelters like you. But you have to partner up with a veterinarian, again, who's willing and smart enough and accomplished enough
You're welcome.
to embrace what you are bringing them and go for a cure or a treatment. And that's where Darcy comes in. There are not many shelters that have somebody as accomplished as Dr.
I know
Adams.
Dr. Todd that used to work for us works with a shelter down in Dayton area, and they were doing the FIP treatments right about the time you started doing the FIP treatments, because I saw her postings.
Oh, really?
And she doesn't practice.
Oh,
she
okay.
just does that shelter's medicine.
Really?
So there are ones that do, and it's all cats, I think. I don't know if it's all cats. But, so she's one that worked with us for a few years, and now that's all she does.
Yeah.
Really? Yeah.
But I imagine she's paid through the Humane Society or shelter,
Yeah.
you know what I mean?
Yeah.
Something like that. She does her surgeries and...
Well, and I tell you all a lot at how much Dr. Darcy is there for us, and you know, and I desperately try to not bother her on times off and
No.
days off, but you know, she's unfortunately always there, and,
Always by my side.
and you never have. It's always some sort of medical emergency or you know, of course. They're my baby, so I feel like it's a medical emergency. You're like, oh, well, we can do that in a couple days.
Yeah.
But
Yeah.
Can you imagine your MD giving you his personal phone number to call anytime you want it?
Exactly.
Every client
Exactly.
that sees Dr. Adams at our clinic has her
Yes.
cell phone number. And she has not burnt out. She hasn't blown her brains out.
Yeah.
She still embraces that because this is the person that she is.
Yeah.
And the problem with many shelters and rescues is that they have to just accept who will ever help them
Yeah. Absolutely.
and hope that they're competent, and that's not always the case.
No. So we got incredibly lucky, and
Well, that's why I thought he should come, because he's the one that started the whole thing with Jackie. And I can remember starting there in '03 and Jackie being in his office and them going round and round and almost having some disagreements.
Mhm.
You know what I mean? They had a great relationship, but you know, there's some laws and there's some rules,
Yes.
and
there's a
you're
lot of
very good at you follow the legality.
I try very, very hard.
But you
unless
can't-
there's something that came up
but-
that I didn't.
And I know I stretch the rules a little bit here and
Yeah.
there, but I feel like we do a really good job.
Yeah.
Doing a good job and still being legal.
Yeah, there's so many finite laws that you can't do, and you have to be incredibly careful with. And some of them I have learned along the way and realized, oh nope, can't do that. I can't. I remember the first time I started here, I was very new and I was very excited, and someone called me and said, can you do a blood draw on one of my cats and test for FIP or FIV and leukemia? I'm like, oh yes, absolutely, I sure can. I'm so excited to do a blood draw. I'm learning this. This is great. And Jackie's like, oh no, you can't do that. That's practicing medicine. I'm like, oh no. So there's so many.
Not all these.
Yeah, I practiced enough now. It's not that exciting. Oh golly. So how long have you guys been a vet? How long have you been a veterinarian?
I have been a veterinarian for 50 years, practicing. I had back surgery a few years ago, so I retired a little bit, but now I am doing the Defiance shelters surgeries because Darcy won't let me back in the clinic because I would then be taking their surgeries and they all want to do surgery, and there's enough doctors in my practice right now. So I'm volunteering at the Defiance shelter and doing their spays and castrations and all their medical treatments.
And it's nice because he can do a surgery and then go sit down and rest his back. It's not like...
Got a little back problem.
You know, it's not like, okay, come on, you know, we got this down, you know what I mean? Right. He can do it and not...
Yeah, and since they don't pay me, they don't care how slow I am.
We're just grateful for whatever. And how long have you been?
39 years, I
39.
guess. 86.
Yes, neither of them look old enough to have worked 39 and 50 years as a single career.
I know, that's crazy. Almost 40 years.
What made you want to become a veterinarian? Obviously, look for you.
Sure. Wow. Darcy told me I'm not allowed to give long, drawn-out stories, so I don't know. I always had a love of animals. At one point, I told my mom I think I'll be a doctor, and she said that's nice. And then she said what kind, and I said I think I'll be a veterinarian. And humorously, she said, well, that's nice. We've never had one of those in the family. So I don't know the reason, but human medicine was not in the picture. And I really have struggled to answer that question every time it's been asked. All I know is that's where I was directed by God.
Led.
To do.
Yep. I love that. I love it.
I grew up on a dairy farm, so I was going to work with cows. Yeah, to the point that I did not take my small animal stuff. Now they've got it so you have to take
both of them.
Well, we did, but you could really focus on one.
Okay.
More than now, which was bad because I didn't take cardiology, ophthalmology, neurology, all the things I ended up needing for small animal.
Right.
When I decided after 2 years of pulling calves and flying down hills and the chaos of what I lived through, I was like, this is not for me. That's not going to work. But so then I decided to do all small animal, and then I had to go to a lot of conferences and
oh, for sure, that would be quite the change.
I learned it in the books, but I didn't have those rotations.
Yeah.
And I didn't spend as much time observing at the clinic the small animal because I thought I was going to do herd health and cattle and.
That would be such a complete change.
So yeah, after I started doing it up in Michigan, and I had a technician, and I'd call him with questions. I didn't even know how to trim nails.
Oh no.
And so they had bets that I wasn't going to make it.
Oh really?
For 3 months.
Oh my gosh.
They just said, give her 3 months, she'll be done. Because I had to do all small. My first job mostly was small.
Mm-hmm.
But I had to do on-call cows and horses. So I only did it a little bit.
Oh gosh.
So that was really hard because I didn't learn it and do it every day.
Right.
And here I was doing a small animal every day. But she really pushed me to do, and back then there were no specialists.
No.
People were like, can you just try? And because there were no euthanized things.
Right.
So yeah. I'm dumb, I'm young, no, I guess I can try. He says I can do it. Pam says I can do it. One time I was trying to, it wasn't really back surgery. I was trying to screw a pelvis back together on a dog, and I worked with all guys that did large animal. They come strolling in off the road. They're like, what are you doing? Because it looked like I was doing back surgery. I mean, it had the spine there and the pelvis. I'm putting screws in. They're like, you can't do that.
Was the dog fine?
It walked a little crooked, but it walked. I had it screwed crooked, but I don't know.
Well, when I first started, I spoke to Darcy a lot. I still do a little bit, but because there's just so much to learn with just even cats alone. But I would speak to Darcy a lot about questions, and she's like, oh, I started out with large animal. In the beginning, I called Dr. P all the time.
I would call him. I remember he said one of my first questions were, what's Panalog?
Oh,
that was
deadly.
Yeah, and after a few months or weeks, he said my questions got harder.
Yeah.
But I was like you.
Oh, yeah, I called her I remember I called her one time and I was just a little stressed and I'm like, a cat is coughing. I don't even know, is this important? Is this needed? You know, and she's like, oh, I called Dr. P for, you know, same thing.
So I'm going to reveal the truth all of a sudden. And
no.
Darcy has never heard this before.
Uh-oh.
Her questions got hard enough that I would delay my answer long enough for me to look it up to make her think I knew the answer.
Oh.
And I didn't know the answer because they were that difficult to answer.
She is so super smart.
But I
she's
had
still...
a technician, Pam, could have been a vet. So I was really blessed because she worked at a really good clinic before the mixed animal where she ended up working.
Uh-huh.
And she could read x-rays. A dog would come in the room and we'd walk out and I'd be like, oh, I don't know what this is. She'd go, well, I think it's probably liver failure. And she'd be right.
Oh.
And I'd be like, she'd listen to the person.
Yep.
She'd look at just the patient and just that natural gut feeling of what it was. And she was right so many times.
Oh,
I'm
that's
like,
awesome.
I want to be like that. How does she do that? How does
That's
she
just-
know that? But it was just paying attention and being able to
And
remember
it's-
and listening to the owner and
It's
you know.
being thorough, and then it becomes part of the art of medicine.
Yeah, she
beyond
knew the art,
the
even though-
science. It's the art of medicine.
Knowing which one
And
to
that's
do.
what I really wanted to have because I couldn't. And she wasn't even a veterinarian, but she was.
It's nice though to have someone
so-
like that.
Yeah.
Yeah. So that mentoring me for all those years and not letting me give up. Her famous thing was, because the guys were large animal, they're like, ah. And she's like, and so sometimes they did small animal and they didn't want to do it. And she's like, they'd be like, this isn't going to make it. And she's like, let's just pretend it's going to live and treat it like it's going to live.
Oh,
You know, that was her
amazing.
thing. Let's just pretend it's going to live.
I love that.
I can always remember.
I love that.
But she didn't have to say that to me, but
Right.
she would push me and say, "You can do this. You
That's
can pin
amazing.
this leg." She'd run the pin down. I'd hold it together. 'Cause
She's
we didn't
become
have
an
help.
amazing surgeon on top
Oh.
of all that.
We didn't have help,
No.
Oh, she is so
so
good.
I think she
not as good
adopted
as him.
a
But
philosophy that I had is that, especially if you're dealing with an issue that is felt to be inoperable, and it's you cut until you can't cut anymore, and you know you reached a point that you cannot do any good, but you don't give up until you reach that point.
Yeah.
yeah, and I can remember him pushing me. I opened a dog and it had a big mass, and I was like, "Okay, we're done." He's like, "No, try to dissect around it." And I'm like, I was mad. I was like, "This is stupid. You know, this is not gonna live. Look at this mass." And he made me, work at it and dissect around it till we saw where it was coming from and that it truly was not just a granuloma or a cyst or, and he's like, "Now you can quit."
Wow, that's amazing though.
But
what,
he would remove, I will never do surgeries. He did. He's removed liver lobes, lung lobes.
That's not true, because I guarantee you that when she sees something that she knows I have removed, she is going to say, "I can do that. If he could do it, I could do it." And she will do that.
Maybe it's a cat, not a big dog. Cats are easier.
So what would you say is your most favorite part of being a veterinarian then? The hard cases?
For me, yeah, the challenge, and learning more, as long as my brain can learn more. And hold it.
Yeah, right.
You know what I mean? I think that's the excitement, is to just have that challenge of, obviously I refer things that I know I shouldn't do. You know what I mean?
Right.
There's a point where you need to know that point. But to say, okay, I'm going to try to do this for this pet, and try to just, think of it in that mindset.
Right.
I'll research it, I'll study the anatomy if it's surgery, or I'll, research this, and then to find that answer, I think this fits together, I think this will work,
Yeah.
That puzzle fixing
Element of it. Yeah.
probably is the challenge that I
Yeah,
like.
I have to say the exact same thing. It's the challenge and the people. And you can't be a veterinarian,
Yeah.
as I tell the kids that come and visit, you know, they'll say, well, I want to take care of animals because I hate people.
Oh.
You cannot be a veterinarian unless you love people. Because if you love people, then you are going to make that cow healthy, you're going to make that horse run, you're going to do things to make the people happy and have that pet, that animal, whatever it is, be a part of their lives. And it's the challenge, and it's dealing with the clients who, like them or not, you got to love them enough to take care of the things that they cherish,
Yes.
which is their pet.
Yeah.
And I think if you're an auto mechanic and somebody that can't afford something and brings in their car and loves it to death, well, I think the mechanic owes it to their profession to do the best they can under all the circumstances presenting, because they love the challenge and they
Yeah.
want to make that person have a better life.
Yeah.
So I don't know. It's maybe tough to understand, but it's got to be that you love the people as much as you love the pets.
That makes a lot of sense, which is difficult to handle, because sometimes I'm sure you guys the people can be
mean sometimes.
mean.
Yeah.
And
here we are
some
long
of it
after
difficult.
COVID, and the veterinarians would see the client, but only if they would park in the parking lot and they would take the pet in.
Mhm.
And there are still practices that do that
Yeah.
because they really don't like the people. And then the pet does not get treated properly because they can't get the history, which is extremely important in
Mhm.
understanding the pet's problem.
That makes
So
perfect
if your
sense.
veterinarian is still seeing your pet and are parked in the parking lot, won't let you in, then I'll catch a lot of grief. But you need to see another veterinarian.
Yeah, that actually does make sense, and I think I would assume it would go a long way to calming the animal, maybe.
Yeah.
To have their owner present
Yeah,
with them.
sometimes there's a few times we take the animal away. There's a few, and
Yeah.
people will admit this is, and I've done that with my daughter.
Mm-hmm.
This is going to be. They're like, "Do you want to come back?" No, she will be worse with me there. You take her. You know what I mean? So
Now the other part of being a veterinarian, how do you guys deal with the sad days? That's so hard, and the burnout. How do you deal with that?
I think, because I do deal with it a lot better than a lot of the people I work with who
Mhm.
have very soft hearts and very emotional, and a lot of those are artists or musicians. You know what I mean? There's
Yep.
a different. Everyone is necessary. Everyone's needed, and those people are really important in the practice. But they reach a certain level of burnout.
Yeah.
You know what I mean? With euthanasias and with the sadness. I think that part of mine is because I grew up on a farm.
Yes. Yeah.
And I think I have a very realistic view of what life is. And life on the farm included a lot of death. And I learned that
Yeah.
because I experienced it. I had a book of all my cats. I had them all cataloged. I should find that sometime.
Oh my
I had
gosh.
pictures of them and the family trees. I mean, I just loved the cats. I'd sit out there and play with them, but they obviously would, a lot of them would get run over, they'd get killed, or
Yeah.
the tomcats would come and try to kill them, and it was scary, the tomcats, and my dad would shoot the tomcats, or they were going to kill the kittens, and
Yeah. It's.
you know, and I remember one had maggots and it was really sick, and I was like, what are we going to do? And Dad had to kill it.
Yeah.
You know, I mean, that's horrible, but I knew that was necessary.
Yeah. Right.
So,
you have a better understanding.
I don't want to say I'm hard-hearted. He's very, very soft-hearted. I don't have that.
I'm going
as
to
I would
interrupt
like.
only because Darcy is giving an impression that doesn't exist except in her mind.
Exactly.
She grew up knowing that cow had a monetary value. She has transitioned to an emotionally charged aspect of medicine where she is taking care of not something that has monetary value except in the heart of the patient, of the client. And she has transitioned from being what she calls cold-hearted, which she never was in her life,
Yeah, right.
to being extremely empathetic. But to practice good medicine, you have to separate yourself away from what you're doing, otherwise you become paralyzed
Yes.
with the emotion. And the technicians and the assistants don't have to do that. They just have to,
True.
they watch, they aren't part of being the quarterback of the team, but the quarterback of the team cannot be paralyzed by their emotional commitment. And I think that's where MDs also get a bad rap. They seem to be cold-hearted, but they aren't. If they lived and died by every single patient that presented to them sick or dying, and if they become paralyzed, they're unable to help and treat that
and probably
patient.
that's what goes through my mind is, knowing what's best.
Yeah.
You know what I mean? And not wanting an animal to suffer.
Right. Right. Because that's
She has
such a.
I really feel
never
really
stopped
bad for them.
treating that pet as if it was her own.
Right.
No.
Never assigned a value. So
Right.
I just want to make sure
Yeah.
your audience understands
I mean, I guess
that
that's true, but
Dr. Adams does not come close to understanding how emotional she is and how sympathetic she is. But she's very professional.
I tell you guys all the time, do I not, how absolutely amazing Dr. Darcy is. She is always so kind. If I make an oopsie, I could probably tell them about the Panicure that I did in the beginning, the Panicure dosing.
I can't remember.
The dose that it's dosed at 0.23 and I was dosing at 0.1 per pound.
Oh, okay. That's not.
In the beginning, I had my dosing chart wrong for a dewormer.
Yeah, it's not.
And one of my I was dosing the dewormer wrong for 6 months. And I found out afterwards that I had been dosing it incorrectly.
Oh, because we had worms.
Yes, because we had a parasite. We had worms. And I couldn't figure out why. I'm like, I'm giving the dewormers. I don't understand. I don't know what I'm doing wrong. And I had been dosing it at a
Half
dose.
the dose.
Less than half a dose, I think. I was doing 0.1 per pound, and it should be 0.23 per pound.
Okay.
Oh, that'll never leave my mind. Ever. On my deathbed, it will be Panicure 0.23 per pound. And she was so very kind to me. She didn't get mad. She didn't yell. And I get frustrated. I get annoyed. So I would be like, "Why'd you mess this up?" And Dr. Darcy, of course, was like, "This happens. We'll remember. It's okay. It's just some worms.
A dewormer.
Just a dewormer.
Could be worse.
That's what I think you said that.
Yeah.
You're like, it could be worse. We could be misdosing something
Yeah,
else.
I think he's right. As the doctor, it's like a hospice nurse. I wonder how they do it.
Okay.
Yeah,
exactly.
So they have to detach too.
Yeah.
Same thing.
There's so much to learn. So the other question we've already somewhat touched on just a tiny bit. Speaking of,
well, my computer's off because of the storm, and it's like I'm missing stuff.
Oh,
this is the baby
kitten.
that you helped show me how to
I showed her how to tube
feed.
Oh yeah.
And look at his tummy.
Oh, I gotta take a picture of that one to show Chris.
Dad, you helped you during the tube?
Yeah, Chris, we had 2 in a row that needed tube fed, and we had to teach.
Look at that belly.
Not anymore.
That's Beatles.
Beatles?
Yeah, I'm sitting in here being all disappointed, and I realized I
Beatles.
can just come out.
Oh, Beatles.
Beetle bomb.
He saw his first sunset, all thanks to Dr. Adams, because she is so wonderful showing us how to tube feed these babies.
Look, he looks so worried.
Oh, he's so precious. So, I know you guys are in a hurry, and I hope I'm not keeping you too terribly long.
Okay.
So we've already touched on this just a tiny bit, but how do you guys feel that there is an FIP medicine out available for the public?
I never thought I never thought I would be still in practice, or even if it was possible to cure. I mean, we still, I guess, don't know. We think it's cured.
The long term.
Yeah, the long-term
yeah.
FIP. I mean, it was at every seminar. It was the bane of everyone in shelter medicine. It was horrible.
Yeah.
I just can't believe it.
I know. I
just cannot believe it was possible. You know?
That's what I say. I feel like it's almost the equivalent of like a curing a cancer that you would have
that's
never
how
ever
I think of it, like.
cure ever, and now all of a sudden it does, and it's so exciting.
Yeah, I go back to the days when they didn't even know what FIP was.
Yeah.
And distemper even had multiple words to describe it as its title. But when I got out of school, we didn't even know what is now the FLV and FIV diseases were, and everyone that came in that had a positive test for it, you'd euthanized, and now we know that doesn't have to be done.
The saying was always a yellow cat's a dead cat.
Yeah.
Really?
A yellow cat's a dead cat, and unfortunately, I have a hard time. Yeah, I have a hard time getting that out of my brain because it was what we knew to be true. If it's yellow, it's going to die.
Really?
So FIP then, to have a cure and have research at this level, adding to what we know, because eventually Darcy's going to put the 10 cases that you've cured and post them online on a professional website called VIN, and she will have treated 10 cases and be better than 95% of the veterinarians, because clients aren't going to treat them, but she's going to add to what we know because of what you do.
I know, I'm anxious to
and
go
if
to
it was
this seminar,
not for
get
you,
this panel and see what they say.
Yeah.
so if it wasn't for people like you, we would not get the understanding, because research at the institution level is not as valuable as what we learn out in the field.
Sure.
And you're in the field.
Yeah. It's very exciting.
You have to have, someone's got to pat you on the back for taking a chance and doing this.
You pushed me.
At a high cost.
Let's try this. I'm like, oh, okay, I can't give it. It's illegal, but okay.
We'll try.
And someday we will have a cure for cancer. And,
that'd be awesome too.
Someone's going to say, never in my lifetime, when I got out of school, no one said this was going to be curable. And we're already seeing it in certain diseases.
Yeah.
You just got to be tried.
It's very exciting. We get. I hate seeing FIP. We still hate FIP.
But
hate
it's
it.
not the
But
same
it's,
feel.
Yeah. Now, with the exception of Amy, when Amy came in, I thought, oh no, this is going to be the case that's not going to make it.
Yeah.
That's
because
what I
that
thought.
would have been that yellow. If it's yellow.
Yellow cat's a dead cat.
Yeah.
Megan, not everyone gets to make a difference. And someone's going to say, oh, you just take care of a bunch of cats. But this is a virus that is going to be applicable in some way, some shape, some form to human medicine. And you have made a difference. If you never take care of another cat, forget about these cats that people think you're crazy for treating.
Right.
But science has been advanced, if not that much, but that much from what you've done.
Wow.
And people worldwide don't know it, but that is true.
Well, it really
No,
doesn't.
you had to accept the challenge.
Yeah, and she was so excited. I was like, well, I can't tell her no. Because that would be really bad, so I guess I'm going to say yes. You're like, okay, I think I can do this. I think we can
But then
do
the
this.
first time we had a blood draw for it, after we had treated it for a while, she was like, I could tell you were excited because you sent the results like right after I could tell that blood draw was done. You're like, oh, looks at me, this is better,
Yeah.
It was very,
Yeah, it was crazy.
it was, yeah.
And then I was on board.
Yeah.
I'm enjoying reading these comments. I think you have a wonderful listener base.
Oh my gosh.
And,
you do.
and for them to recognize that you're more than just a crazy cat person, that you have love in your heart and you want to do more than just feed a stray cat.
Thank you. We try, don't we? We try. It's tricky, but we're getting there. So I have a couple more questions. If you guys have a couple more times, it'll be quick.
Your cat just erased it.
She does this. This is Butterbean. She's the sweetest cat. She always has an upper respiratory. You can never clean her nails. She will rip your face off, and you can't hold her.
That funny?
Yes. So I think this is very interesting, and I see this a lot. How important is yearly wellness checks?
Oh, so important. I mean, just the last couple of weeks, all of us at work were saying, we've had people come in that haven't come in for like 4 or 5 years, and all of a sudden there's this loud heart murmur. This is maybe in a dog. And we're like, it's so different. If you hear the murmur and you follow it along year to year, that's not the same as last month it was in, or last year it was in, there was no murmur. And now there's a grade 5 out of 6 murmur. That's a whole different disease. That's a whole different thing. But if you don't know when it started, how it started, and you can't catch it early, you can lose 15 months of that dog's life. It's not the same in cats,
right?
Necessarily, because cats are a little bit harder with their murmurs, but that's just one incident,
Yeah, I love that because I see that so often where
we just are starting. It's like you getting a cat in with no history.
Yep.
If we see it every year, or even every other, we have this history. We have this past.
A pattern,
we know
and you can...
because they can't talk. So I always feel like, oh my word, I don't know what this is, and then I'm like, okay, this is just as if Megan got a cat in, or the shelter got a dog.
Yeah.
Like this happens, just deal with it. But it makes it so much harder.
I love that.
And we're not as good.
Yeah, you can only...
And you can make more mistakes because you don't know when it started. You don't have a time frame for anything then. And it ends up costing more too because you can't catch the little things along the way that don't cost as much. Yeah. Then it's a huge bill all at once.
See, I
and maybe
love
can't
that.
do anything because we haven't followed it. We don't know the progression,
Right. I think that's, I didn't even think the heart murmur. That's amazing. I was thinking teeth.
Yeah, teeth is another one I was thinking of. I always tell people it's better to take 1 or 2 teeth every couple of years than have 20-some teeth after 5 or 6 years.
Right, of pain.
And $1,000.
Yeah.
I
love that. And then,
if I can interject,
please,
the most common disease we have in pets is cancer. 1 out of 3 cats and dogs in their lifetime is going to get cancer. And that's very similar to the human, which I think is 1 in 4. As sad as it is, the earlier you diagnose it, the more likely you are to cure it. A cat with an abdominal mass is 80% malignant. A dog with an abdominal mass is not that highly malignant. And if we can palpate it and get rid of it, we can save a pet.
Oh, yes.
If we see one of the most common skin tumors on a dog, a mast cell tumor, if we can remove that early, we save it. If we see it when it's become as big as a baseball, we're probably not going to save that pet or be able to remove it adequately. Or if we see a lame dog or kitten and it's got a bone tumor, that is a highly metastatic disease, and the earlier we see it, there's no treatment other than amputation, then the better chance we have of saving the pet's life, even if we can't save the leg. So cancer is a huge problem, and we need to be seeing the pets at least once a year, at least. And if you're not taking your animal in, whether it's a gerbil or a cat or dog or whatever, hedgehog, whatever the pet is, cancer is part of the rule outs on anything we see when they aren't feeling well. And the earlier we see it, the better we can do to get rid of it.
We don't see
a breast tumor.
Yeah.
A dog that's not spayed before 2 heat cycles has an extremely great chance of developing breast tumor at a later age.
I'll be dang.
If you get that pet spayed before it ever goes into heat, then you are going to prevent a uterine problem, an ovarian problem, but more commonly breast cancer. So
That's amazing. And that was another question we get quite a lot is how important is spaying and neutering on an inside cat? And, you know, I'm sure it will prevent a lot of different things, but it also, I think, prevents cats
most of the mammary tumors are malignant in cats. So we see that. Unfortunately, cats that are even spayed older, it can happen. But dogs, it's, I think, probably more. Something we see more. But yeah, it's...
Well, more importantly, that cat goes into heat constantly. They do not go out of heat until they're bred.
Right.
And so the person gets sick and tired of hearing it, and they throw it out, and then we have a kitten population problem.
Right.
Exactly. Now, my other question is just as far as general care is, how important is flea treatment for inside cats? How are fleas nasty? Like, how bad are they? I mean, do they cause much damage? They're little bugs.
They carry a lot of bad diseases. I mean, we have seen cats too that we don't even know what disease. They'll be covered with fleas and they'll be sick and we can't find what's wrong with them. This has happened to us several times. We just get rid of the fleas and they're like better in 2 days. And they're not anemic. They don't have Bartonella as much as we can tell. Don't have Mycoplasma haemophilus. Those are all bacteria that the flea can spread. Toxoplasmosis, you know, I mean, they don't have any of those diseases. Maybe they do. You know, we don't always test for everything fleas carry, but they're just better when you get rid of the fleas, and we haven't even treated with anything.
And I don't want to be self-serving and say, well, veterinarians need to make money and treat an inside cat. If you have a cat, then you have other cats that are coming up to your door and sniffing around, and they're outdoor cats. They're dumping fleas at your door. You walk through the door, you're carrying fleas in, the cat gets it, now the cat has fleas. So treating and preventing fleas in a cat is very important.
Yeah, they get a lot of flea-borne diseases.
Right, but you
more than
cannot
dogs even.
fall for all the flea collars that say they prevent fleas except for Seresto one. And all of the flea products over the counter are not good flea products. You got to know which one you can get. There are good ones that are over the counter. The ones that contain fipronil. I know I'm getting into stuff I probably shouldn't, but you need to prevent fleas.
Yeah, and I do tell people which ones they can get over the counter to be economical. You know what I mean?
Yeah.
They may not last the whole 4 weeks. They might be 3 weeks, but some of them are downright dangerous.
Yeah.
You know, like the Harts and the Sergeants, and we've seen cats, and we just saw one the other week that was put on the spot on.
Don't tell anyone the 2 names that Darcy.
Why?
All right, but the word's out.
Yeah. Well, I mean, there might be others. I don't know, but they have pyrethrins and permethrins in them, and those can be toxic to some cats.
It's amazing how much you learn and how much little tiny bugs cause a problem that you would never think.
Yeah, I had a client come in. She has a bunch of barn cats. She takes super good care of them. The barn is, you could eat in their barn. Like, it's not like you think of a barn. It's super clean, and there's a group of cats in the barn, and there's 3 or 4 in the house. The house cats had fleas, and not the barn cats.
Jeez.
Somehow they got in the house.
Yeah,
they
they're
were
in the
horrified
house
yesterday.
Sure.
And then they're biting you.
Oh yeah.
That's going to create a staph infection. People have a really crummy immune system. And I'm not saying fleas can kill you, but fleas can cause disease from the things that they carry that an immunocompromised person can become extremely sick and potentially die from.
It's just amazing. These cats, we've seen them in here a few times where you've had just a flea issue, and they are just so incredibly dehydrated. They have sucked them dry.
They itch so much they won't eat, they won't drink. They're so uncomfortable.
Yeah.
They'd be covered with poison ivy from head to toe.
Yeah. So thank you. I'd like to touch on these like simple things that are important to do every year.
There's no such thing as simple.
How about ticks?
Yeah, true.
Oh,
simple.
ticks are even more disease carrying.
Yeah, ticks are yucky too, and I think a lot of flea meds, I think, generally cover those.
Yeah, most all the flea meds. Well, not all, but most of them cover.
I guess I feel like most people.
Well, the Revolution doesn't cover all the ticks, but a lot of them cover all the ticks now and fleas.
and one gravid female tick. So you have the little tiny hard tick that's usually found underneath the big fat engorged tick. The engorged tick's the female, the little hard one's the male. It's birds and bees. If that female drops off and lays the eggs in your house, you have 10,000 ticks now in your house.
Oh no, that would be my nightmare.
So,
I cannot stand it.
okay.
Oh. That is awful. So I have one last question for you guys, and this is just a fun one. What do you guys like to do for fun? What do you enjoy to do when you are not working?
It depends what year you talk to him. Like now he's
She's
into
asking-
horses.
Go ahead.
I ride
I
my
tell you
bicycle,
what, I have
and I like to
6
work in my
going,
garden,
and
and
it's
hopefully I'll be able to
for the
can some
best.
beans this year. I'm really nervous. I got a pressure canner for Christmas.
Oh,
Yeah, and it's still unwrapped in the box, and every time I walk past it, I'm nervous because I don't want to blow off
I
the
know. I
lid
hear
and
you. It's not
blow up
giving
the
me.
house.
Oh gosh.
So I'm gonna try
Okay, prayers for that.
candy.
Call me, I can help you.
I've done it before, but always had someone there. It was my mom's old canner, so I got a new one. Should be easier.
The
Yeah.
new ones are much better.
That's what
Okay,
I'm
there you
remembering
go.
the old style.
There you
So
go.
I'm real nervous.
And then
Well, my passions when I thought I was going to retire before I developed the back problem was fishing and golfing and traveling and vacationing on a beach.
Thank you so
Now,
much.
every one of my dreams have been eliminated, and I go back to the old saying where man plans and God laughs. So now my passion is, to a degree, eating, which you can tell by looking at me, cooking, not so much eating, well, eating also. But my passion now
He's a really good cook.
is horses. It was coaching soccer. It was the Civil War. It was,
Thank you for that.
I go
We
through
appreciate
phases,
it.
so I guess I'm a flake.
I'm the same way.
Well,
I
this is the
change
joke.
everything.
This is the joke, though. Like, my daughter's even said, if he finds out you like something, for Christmas,
Mm-hmm.
you don't get one of them. You get 25 of them. You know what I mean? Like the donuts.
Oh, yeah.
Not just
Oh.
one donut, 4. So I
you never
happened,
know.
I happened to say, oh, this is my favorite kind of soap because my daughter gave it to my other daughter for her birthday. And he's like, what kind is it? And Malin goes, well, you're going to get 25 of those for Christmas, So that's the same. It's like all in.
Yep.
But that,
All for
I
it.
can't deny it.
that
I'm sorry.
served him well when, he was an amazing surgeon in his day. There wasn't anything he wouldn't tackle.
She still says to this day.
And
she's
I'm
like,
not.
I gotta check with Dr. P on this one.
Yeah.
I'm gonna ask Dr. P.
Now, if it comes to the internal medicine, that's easier for me because it's my brain, and I can look it up. He's much more hands-on,
Yeah.
mechanical. I'm not. You know what I mean?
Yeah.
I'm more. I didn't know that in vet school, but you find out what your gifts are
Right.
after you get out in the field. And my definite gift. I love doing surgery, but my gift is the way my mind works with figuring out internal medicine cases.
Right. Right.
And I know that's my strong point.
Mm-hmm.
But I'm glad I
You
get
get
to
the
do a
main-
little bit
I
of
got you down.
everything,
Thank you so
Yeah.
much.
Is there anything else you want to say before I wrap it up and let you guys go? Because I know you guys are heading to a conference and just
He's going to horse farms.
horse farming.
I'm going to
That
Lexington.
works too. Oh.
And
touring horse.
if
I'm going
anyone's
to,
out there that can get me on a really good horse farm like Calumet, I would really appreciate it. But anyway, no, I'm trying to read the comments, and I'm amazed at the audience and the interest in what this facility gives to this community.
That's Edna.
Edna?
Edna R. I don't know. If
yeah,
You, yep.
she comes to the clinic.
Yeah.
I'm just,
They're amazing.
it's, I can't even say how impressed I am with not only what you do, but how the support has helped you do what you do.
Yeah.
And without that and without them, you can't do anything.
Oh no, and
So-
and they are so kind with our with our craziness. We had Dr. Adams and I worked on Buckeye for months and months. I think it ended up being like 10 months. We worked to try to close this
was
the
a
skin wound.
I have to show you the
And
pictures. They
and
had
it would
use
start
the
to
skin
close. We would get excited, and it ended up costing like $10,000 at a specialty vet to use the skin back and close it, and they were just like,
I know, we
let's do
tried
it.
everything.
Yeah.
And you
that's
could have
the
just
way they did.
euthanized, you know, but it felt
Yeah.
more
Way
right.
back when, and it was, I can't remember when, but I remember when Jackie and I would sit down and I would come here year after year after year and help her like Darcy does now. I knew she was putting money from her own pocket of what she and her husband were making elsewhere into this facility. So Jackie out there deserves a whole lot of credit for getting this going and helping it get going. But without this, you can't exist.
Yeah.
And you have been, and all these helpers are amazing to look at all these people to sustain this. It's, you know, if you build it, they'll come.
Yeah.
And
If Jackie had not started this, she put so much time and energy, financial, sweat, blood, tears, everything into this, and then with the help of you guys, of course, I don't think I could start this. It would be too daunting. It would be too overwhelming. It'd be too scary. So, yeah.
Yeah, that's why I thought it was good that it worked out he was here, because I remember him and Jackie from the base ground starting this.
And that,
yeah, and
Before I
we argued a lot.
I remember hearing them argue, and I'd be like, oh, no. Megan and I don't argue.
No, but Jackie at the time was not practical. What she wanted to do was not economically feasible. But many of the things that I said was not economically feasible, she did it. And she did it because of the money she put into it. And this can't exist without cat food and litter and and the treatments. And so a whole lot of people can go a long ways, more than one person can, to sustain a facility like this. So.
Yes. Yeah, they are absolutely amazing. So you guys are absolutely wonderful. Thank you for all you do. And thank you to our absolutely amazing vets who are just wonderful. And of course, Dr. Adams, who
Crazy, loving medicine. I love medicine too.
who answers my calls.
Great aunt was like one of the great somebody way back when, was one of the first human physicians
Really?
in some school. Like,
Oh, wow.
so maybe I have medical
You probably do.
knowledge in my background.
You're very good. And she's always kind. I feel like half the time I'd be like, Megan, I've told you this 40 times already. And she's
That's
like,
not true.
I'll tell you again. I mean, you never even say again. You're like, of course, here it is. So she's very,
How I
very
learned.
kind. Yeah, you over and
You
over.
teach me.
So thank
Hopefully
you.
I'll bring back good stuff from the conference on
Ooh, yeah.
diarrhea and FIP.
I know, it's kind of exciting.
I know, and I haven't even looked at Friday and Saturday
When you
stuff.
see something about poo, you're like, oh, there was a class. We missed that last class, but we were gonna go, and there was a class on Giardia, and I'm like, oh, I'm gonna take that. I know what that is. I am so excited. Let's learn about poo, and it's just kind of amazing how
I
much
know.
you have to look at poo to
Yeah.
figure out what's going on. Oh, you helped Rory. Rory was a kitty here that had you did
I remember the
an
name.
amputation.
I
an
remember
orange and white.
Magic. You were maybe practicing when Magic was around. I remember that name.
Yep. Yeah.
And also a shout out to you too for helping Rumple Stillskin.
Yep. Rumpelstiltskin, Egypt.
Yeah, I remember those names.
Rumpelstiltskin is around here
Dagda.
somewhere. Oh, Dagda. Yeah, you've done Dagda. He's here.
Yeah.
We've got a
I
lot
remember
of-
those names.
Rumpelstiltskin fell from the walkway and had a little hip injury, and you guys fixed him right up. Yep.
Yeah.
Vincent. This woman had Vincent, one of our kitties that treated for FIP.
He was one of the first, wasn't he?
Wheeler.
Wheeler was the first.
Cindy's cat Wheeler
Yeah.
was the
Yeah,
first.
I remember Wheeler.
He was the one that took injections for 84 days. So did Vincent. 84 days we did injections.
Show
every
Dr.
day.
P magic.
Oh, where's the
Who's
magic
Magic?
man? Oh, you know.
He doesn't
I'm-
have back feet, right?
Nope.
He has no back legs.
That was the first.
One of the
Oh, there's Rumples right there. He's like, you fixed my legs. Do you find him?
Yeah, he's with Alma.
He's with Alma? Oh my.
Yeah.
Oh, what about Cheerio? Oh, it's funny.
Oh. Yep, Cheerios
See?
around here too.
Wow.
Oh, there's
So this
there's
one,
magic.
It kind of has
I
like
pity.
what do
Yeah.
I want to say, like a granuloma.
Yeah, and
or-
that's what we had with Slider at the clinic.
Yeah.
But this is proof of what can be done if you don't give up and try.
And he's so happy. He's
He's
so
amazing.
he
And that's
plays.
been a while.
He plays.
I watched you take his tail off.
Yeah, he's
I
lost his
remember
tail
that.
too. I remember that. Yeah.
Yep, he plays and is just as active as can be.
Look at him go.
Oh, he runs like he
That's his
runs.
cat in the West.
Yep, there he goes. See, they all
that
say
looks like?
he'll come
About
speeding
me.
through here. It's hilarious. So,
That's funny.
well, you guys are amazing. We'll let them head out on their way so they
So I
can
can learn stuff.
so they can get learning. But
Well, me.
well,
Well, you might.
you'll
learn
probably
about
learn
horses.
stuff too.
I'm just going to go visit the Secretariat's grave. That's my
Oh,
goal.
that'll be fun.
Yeah.
Probably be fun.
You're kind of like a Dr. Pole, I like
Dr.
to
Pohl
watch Dr.
retired, so I guess we have that
Oh,
in
there you
common.
go.
Yeah.
You guys are wonderful. Thank you so. Oh, look, magic! I smell vets. Thank you guys so much for taking time out to come today.
Oh.
I'm so excited. We were so looking forward to
Yeah.
this.
Our pleasure.
Yep.
Because
it worked out nice.
They hear all the time. I had to call Dr. Darcy. I had to call Dr. Darcy, but now they can see you. So, and then sometimes she says, I had to call Dr. B.
Yeah. I'm like, okay, let me get back with you.
I always get weird stuff. So then she's
Especially
like,
if it's broken bones and orthopedics and that kind of stuff.
Yeah.
I
call
want
him on.
Yeah, or send him the X-ray picture and say, you
What do
know,
you
is this
think?
salvageable? Because I tend to think.
You did that with Rumple. This
Yeah,
cat right
that's what I was
here.
gonna say. He's done a couple
We
things.
thought
where
we
he's
were
like, you
gonna-
can fix this.
Yep, we thought we were going to have to do an amputation, and he was like, nope, let's try to fix that with a pin, I believe it was, if I remember correctly. So,
And that one that I did the wires, he got diabetes. Did he begin with an R?
Rathbone.
Rathbone.
Rathbone,
He's the
yep.
one that said
That's right.
to try to, and I'd never done that before,
Say that
and I
one.
can't believe it fixed itself.
Oh, yeah.
It worked.
Oh, I know.
You know,
Rathbone.
but he ended up, that leg was okay.
Yeah, he was great.
So that's because he said, no, don't take that leg off. You know, he does not like you to amputate legs.
I love that.
He wants
You
to
know,
fix it,
in humanism, you have to be about perfect. In veterinary medicine,
especially cats.
we don't have to be perfect because in humans, they have a bigger bone and they have a greater chance of recovery because they don't have to be perfect. But we're dealing with millimeters, and so we don't have to be perfect, but we have to be awfully darn close, or we won't get a good heal.
Well, that makes perfect sense.
But
Yeah.
cats heal better than dogs. I'm more apt to do something
yeah.
crazy on a cat.
See, I think I would be-
Cats, the old saying is if you took
You've heard this.
2 broken bones in one room in a cat,
It'll
they'll
heal.
find themselves and heal. So in other
Really?
words,
That's the
getting a
saying.
non-union in a cat is very, very uncommon.
But
in a
in
dog,
dogs-
it's a whole lot easier because dogs just don't heal as well as cats.
That's where the whole 9 lives thing
Yeah.
comes from.
comes from. They're
See, I
just
feel like
very
dogs-
good at healing.
Dogs are bigger, though, generally.
Yeah, but
so I
they
feel like
can't.
it'd be
They
easier to work
can't
on.
eliminate infection in their abdomen.
No.
They can't deal with stuff like cats
Huh.
can.
Their immune system is almost as bad as humans.
Really?
Cats have a great immune system.
Well, I did read somewhere, and I'm going to get these numbers wrong, and you're going to be probably like, that's wrong. But isn't it true that dogs have somewhere in the vicinity of like, what, 8 different viruses, and cats have somewhere in the vicinity of like 67 or something like that?
Yeah, that I don't know.
I
I've never heard it, but
would say dogs have more than 8. I think
probably not
that's-
more than cats.
Probably not. Cats, yeah, they've got some pretty, I mean, they don't get FIP, they don't have a viral leukemia that we know of. It's,
Don't have AIDS.
right.
Yeah. It's,
Rarely get toxo. Rarely, you know what I mean? It's the
Yeah.
things that you see.
I think
in
that's where
cats.
it's tricky with cats because, there's only a total of 20 symptoms they can have, it's like how, well, it can lead to like these 30 different diagnoses.
Yes.
It's like,
Absolutely. Yeah.
it's tricky. So
Yeah.
you guys are, they're saying, Darcy, we miss seeing your daughter.
Oh, I'll tell her. Maybe if I can
Oh.
come out this fall.
Thanks for working so hard. Oh, to save Kevin. Kevin. Remember the cat?
Yes. Oh, that wasn't even
Oh, that
really
was-
me.
that
That was my techs. They would not give up.
I remember that.
Yes, Kevin. He was here for like 3 days. I mean, he was here, and then someone's like, "I love him." I don't even think I had.
Yeah.
It's like, let me finish
I'll
the
have to
vaccine
tell.
or
I'll have
something.
to tell. It was Heather and Brooke, I think, that wouldn't give up on that one.
Yeah.
They did amazing. I have a good team.
Yeah.
Yeah, we do.
We have from Argentina. Wow.
We've got people from all over watching you guys right now. No pressure. So, I'm glad I'm telling you that now and not before. So he's doing awesome. He's a chubby little guy. That was Kevin. And Rue. Yep.
Yep, I remember Rue.
Oh, thank you guys.
And my Shambali.
Lots of them.
Shamali. Oh yes. Oh,
Sorry.
no, it
Takes
kind
a-
of slides.
Takes a minute for me to get my balance.
Get these out of your way here. You guys
Nice
are
seeing everybody. Goodbye.
Thank you so much.
Bye, nice meeting you.
Yeah.
Bye, Dr. Darcy. Good to see you again.
Thank you guys.
Hopefully I could get out here in the fall and I'm starting to take, or I don't have to do it on the weekend necessarily, you know.
Alright. How
I'm
much for
starting
the
to
little
take
girl?
Thursday mornings off.
That's my favorite movie.
I want to get a shirt that
You guys are all amazing.
yeah, I do take and she takes a large, but I think she can place
Uh-oh, who's this?
You're at the same place.
Oh, that's Cheerios.
That's okay. Yes.
Can you see now?
Oh, yeah. I'm glad you have this. You're not just a
Well, now you won't, because you're good. Oh, yeah, there you are. It's not the exact time. See, that must have been.
lot different. You know, they're not looking. You know what I mean? It's just stuff. That's what we're doing with the band. I knew it wasn't a year. Oh, yeah, nice car. Not forever. You know, and grass that. Grass that. After some years, you start to get a different perspective. You know what I mean? Like now I'm going back and my mom was like, yeah, let's go through that. But I couldn't think like that.
Just to move you over a little
Oh,
bit.
my goodness, that's a pretty
Move you over a little bit.
Oh my goodness, look at all these.
Now that I think about that.
Aren't they amazing?
Me? Bicycle.